There will undoubtedly be some of you that will roll your eyes, but I don't understand why you do. I don't understand how people are still being so blasé about the multiple and continued failings from MIQ and the Ministry of Health. Because here we go again. We find that a border security guard has not been tested since last November, that there is no system in place to ensure frontline border workers are in fact getting their tests and their vaccinations. MIQ authorities have relied on individual employers and paper trails that were fashionable back in 1953 to ensure workers are complying. The Prime Minister has laid the blame fairly and squarely on the security guard involved, says he was lying, shades of the South Auckland KFC worker, and he may well have been. But shouldn't there be a system in place that picks that up? I would have thought so. Looking at the footage of the Select Committee hearing yesterday, I was watching TV3 News. I don't know if they showed it on TV1, but it was clear the officials at the Health Select Committee hearing had absolutely no idea how many MIQ workers had not been regularly tested. They said there were inconsistencies in the testing records. The officials are still checking the data. But the blank look on the faces of the two women as they looked behind them, perhaps for an advisor who could toss them a figure, and obviously a shrug of the shoulders because they turned back round and like, I don't know. Well, shouldn't you? We've heard this so many times before. The Prime Minister and the Director General of Health have given us over the past year assurances that yes, we concede there's been stuff-ups, yes, we concede there have been human failures, but protocols are in place now and all is well. For over a year now, this has been complete and utter BS. I do not know how the PM can believe a single solitary utterance that comes out of the Ministry of Health or MIQ. There's an editorial in the Otago Daily Times today, and it's along much the same lines as I'm talking. Like me, the writer of the op-ed cannot believe how blasé the public is about these mistakes, the slackness, the false assurances. Maybe, the writer opines, it's because we've dodged a bullet. That somehow, despite these multiple stuff-ups, we've been able to get away with it. It does my head in. And I'm told that I'm just being mean and attacking the Prime Minister and that I'm jealous of the Prime Minister and all other absurdities. I'm not. I think in some respects she's done a great job. But in terms of actually managing her ministries, ensuring that the ministries are performing, in terms of holding them to account when they don't, it has been a terrible failure. And we have dodged a bullet. We have been lucky. We were told that all MIQ staff were being tested at least every fortnight. Wrong. We were told that returnees were being tested on days 3 and 12. Wrong. We were told that there was sufficient PPE. Wrong. We were told we were at the front of the queue when it came to vaccinations. Wrong. We were told just recently that the dire shortage of people trained as vaccinators is what is preventing more people getting their shots. Yesterday, I received this text at 11:45. Kerre, I work for Counties DHB as a registered nurse in a role not related to vaccinations. I have the required certificates to give vaccinations, including COVID. I've offered my services to Counties DHB as a vaccinator. My repeated attempts to offer my services have gone unanswered. And this is not the first text I've had along these lines. Trying to get information out of the DHBs and the Ministry of Health is damn near impossible with that bunker mentality. They have had 2 stinging reports about their performance, the Simpson-Roach and the Kitteridge reports. They pretty much said the same thing. This government sat on these reports until after the election, and still it appears the Ministry of Health has learnt nothing. They've had every resource available to them. They've had more power than just about any department. They can do what they like, which seems to include making stuff up after stuff up after stuff up without being accountable. It also means that the government cannot be confident about the information it's getting from its officials, surely, which is why it is stonewalling and obfuscating and passing the buck. Look at the hijacking of the Health Select Committee yesterday. Labour MPs Actwald did a virtual rolling maul of the committee to prevent opposition MPs asking relevant and pertinent questions. These were not political questions. These were not point-scoring questions. This was actually to get information out of a department that is absolutely unwilling to give it.
They took their time to go through things like we already know, like how COVID has spread. Well, okay, I think we're all sort of on board with that. We got a 5-minute discussion of the end-to-end user experience of MIQ. It's all very interesting. Turns out you're in MIQ for 14 days. Who knew? And so, of course, that was just a delaying tactic because you've only got 50 minutes. Every minute taken up with speaking is minutes that can't be used for questions. And then finally we got to my question, and I got about 5, maybe 6, 7 minutes if you're lucky. And then it was all over. And I moved that we come back because there's so many issues in MIQ, as people listening will know. I mean, we didn't even talk about the high-risk hotels. We didn't talk about the infection control issues. Didn't talk about what happened in the Pullman in February. We didn't talk about the vaccination at the hotel. We didn't talk really about saliva testing and why they're not rolling that out properly. We didn't talk about the fomite transmission in the lift and what they're doing to stop all that sort of stuff. I mean, literally, I had 6 to 7 pages of questions I wanted the officials to answer, and so they had to go away. I moved that they come back next week, and Labor voted it down. So I don't know when we're actually going to see the officials again and when we're going to be able to ask questions to them.
Yeah. I would never clue either. And nobody seems to care. See, one of the first texts I get, do you ever get sick of being a moaning old bitch? Go and live in America, then let me know how good we have it. Can't wait till all you boomers die out in the world as ours. Piss off. Well, if you'd let the galloping COVIDs come in and stop being so pathetic and such a hostage to fear, it would have come in, I would have died, and Bob's your uncle, although I'm not technically a boomer. I'm sure I could have squeezed in there. I do get sick of being a moaning old bitch. I really, really do. But what? The other option is to be, oh, she's amazing, she saved us all. Oh, it doesn't matter. Doesn't matter that they tell us these things are in place. Doesn't matter that they offer assurances and that they're not real or based on false information. I cannot, so that's what I mean. It's just unbelievable that it's my fault for being the messenger. So go and shoot the messenger, shoot the moaning old bitch, see if I care. But I will continue to highlight the fact that this incompetence is absolutely astounding. The stonewalling and obfuscating from the government is appalling. I think it is just there to prevent the world from seeing they haven't got a bloody clue. And I maintain, looking at this record over the past year, it is dumb, pure luck and the fact that we live on an island that all the moaning old boomers haven't died. NewstalkZB, it is 9:17.
KerreMcivor.
NewstalkZB, good morning, Nicola.
Good morning, how are you?
Good, thanks.
So yesterday my mum went in and she got her flu vaccine and she was talking to the nurse, and her nurse hasn't had her COVID vaccine because her appointment was cancelled because they ran out of vaccine. So why are we even considering vaccinated anybody else and random strangers that come up to things if we can't even vaccinate our medical staff, the medical staff that are giving vaccines?
And that's it. I mean, that's just the sheer incompetence of it all, really.
Yeah. So my other question would be to the Prime Minister, if she ever, answered the question.
No, doesn't.
Would be, how come I know more about the vaccine rollout in literally every other country except for this one?
Yes.
I mean, reported continuously on from the UK, America, France, Australia, everywhere except for here.
Well,
it's diabolical.
I just don't think they seem to know. And, you can absolutely forgive a little bit of scrambling in the first month, maybe even the first 3 months. The first year, I don't think so.
Yeah, year and a half. Yeah, they don't think it's a priority. It's quite clear that it is not a national priority to them, and they don't care about anyone else. I personally think we're doing it wrong. I think that the most vulnerable people in New Zealand are the people that are travelling, and everyone who's walking through an airport should be jabbed, because they're either going to come, they're in New Zealand, or that is either going to a place that is higher risk, or maybe they're coming back and so they're higher risk to us. But yeah, the way they're doing it and is awful, and it also means that we can't do things. Like I can't go and see my nieces and nephew for the last year and a half because I can't leave here without a vaccine, and she's holding us to ransom. That's how I'm starting to feel about here, because they're not pushing it.
Did you vote for Labour?
No.
Okay. I mean, I wouldn't blame you if you did, because it wasn't like National were saying, hey, look, here's another way. This is what we're going to do. They were a bloody shambles. So, I'm not anti-government per se. I'm anti-incompetence from wherever it comes.
I think the incompetence was showing during the election, and that's why I didn't vote for them.
Yeah, I mean, 3 weeks ago, the COVID response minister told Parliament 91% of border workers had received their first dose. On Monday afternoon, the Prime Minister said 86% had. There's a big difference.
I don't think we've had a news story. I'm happy that the journalists are finally pushing back. They haven't done it, and they haven't kept the government accountable for the last year. They haven't been asking tough questions, and they haven't been following up on those questions. And now all of a sudden, it is better, but they need to stop asking questions that they're fed, and they need to start looking around and asking tough questions.
Look, I have been screaming about this for months and months, thanks largely to people on the ground who were saying, the Prime Minister is on your show saying one thing, this is simply not happening. And we have been screaming about this. And I've been, the public said, oh, you're a traitor and you're not part of the team of 5 million. But it wasn't true. What Ashley Bloomfield and Jacinda Ardern were saying was not true. But people were so starstruck and so grateful. And so that they seem to have left any kind of critical faculty and just decided to blindly follow and give up any kind of reasoning or intelligence.
Yeah, exactly. And we're all paying the price for that.
Well, yeah, and yet we're living in paradise,
Yeah.
And so we're bloody lucky, really. Thank you, Nicola. NewstalkZB 925.
Auckland, 89.4 FM. KerreMcivor Mornings, engaging in conversation on NewstalkZB.
NewstalkZB. Noel says, I agree, so many texts we can't keep up with them, but I will read out the ones that are counter. I agree with the previous listener message to you. Unfortunately, we have to listen to Hosking, yourself, then a break, then Heather Duplessis-Allen. You're banging on about all the negatives. As a long-time listener, it's quite depressing on your airwaves. I can tell you now, you'll get pushback on your station if you don't moderate the narrative. Friendly advice only, says Noel. Well, that's reasonable, and that's fair enough, and that's, reasonable criticism. I wish I didn't have to be negative, but how can you sit there and consume the news without asking yourself, what the hell is going on? Do you not, or do you just not care? I guess if you've got a lovely life and you're going for walks on the beach and meeting friends for coffee or going for a cycle, or you don't have to care. But I do, because I consume the news day in, day out. And when you see blatant obfuscation and stonewalling, as we saw in the Select Committee, which is shameful, absolutely, how can you not be mad about that? How can you not care about that? Doesn't it make you ask, well, what the hell is the government trying to hide when they won't let opposition MPs ask questions of the Ministry of Health, who are notoriously difficult to get to? Does that not raise questions in your mind? Or are you just a wee amoeba just enjoying the sensation of the sun on your wee amoeba body? Honestly.